unhealthy lymphatic systems, and just the reaction with hypertension and the lymph, that relationship.
So, but let's think about it together. He's not going to spike the high blood pressure with that touch, but maybe the other way. Maybe you're going to calm down the system, and maybe they're going to have a lower blood pressure. And with the meds, you're going to lower it too much. That's something you could think of. Or number two, how to metabolize the medication for the blood pressure. You may metabolize it faster through the liver. So you want to check a little bit if your pressure is going lower, too low, or on the other way, you metabolize the medication and they don't have time to have their effect, which is not common, but once in a while you want to check that. Beside that, where are the places that we know for high blood pressure?
Kidneys.
Kidneys, number one. So you have the kidney, you have the adrenal, the kidneys, you may have the renal artery. What else? The carotid, on your neck that can react sometime and balance, the blood pressure. And then the brainstem. Sometimes you have center for higher blood pressure, lower blood pressure, tachycardia, fever, things like that is in the brainstem. So if you took the brain class, you could do something on the brainstem. On the kidney, you can check, if there's something with the vasculature, if the kidney can be unwinded a little bit. You can drain the adrenal directly on them. We're going to have a class on the viscera. We're going to learn how to do a drainage of the kidney and especially the lymphofascia releasing the fascia and the lymph in the adrenals. So those are the things you can think of when you have high blood pressure. The last thing is for sure the emotion. I had someone here a few months ago. It was really interesting. The guy had high blood pressure since he's like, I think 6 or 7 or 8 years old. And when you ask him, this person was never safe. He was afraid that somebody entered his room. I don't know if he was an abuser or not. I think he was, but he didn't go there. And he was afraid that somebody entered his room every night. So he was hyper vigilant from the age of 3 or 4 until now when he was like 68 or 70. So being hypervigilant like this raised your epinephrine, norepinephrine. He was even on the table, he was just like looking every few seconds if he's safe. And that emotion of not feeling safe and being hypervigilant can create high blood pressure. So those are the things you can look for when you have blood pressure to pay attention to and to treat. Does it help?
Thank you.
Yeah.
Thank you. That was great.